Well, all of our carers here are handpicked by a very experienced HR team, but as well as looking for the minimum criteria, we also look for that little extra something that'll help them, you know, a nice warm, caring personality that'll help them empathise with our clients. We also have a very experienced client administration team who go to great pains to make sure that they are matching the right carer with the client. Well, we get an awful lot of inquiries every week, and all of these are very, very carefully assessed, as I said, by our very experienced HR team. Anybody who appears suitable will then go on for a very intensive interview with either Hazel, who's worked in HR for over 10 years, or Nuala, who has a nursing background of over 30 years. If we, at this stage, they are successful, they will then go on and we will do very, very involved background checks. That includes, of course, Garda vetting, a minimum of 2 verbal references and at least 2 written references, as well as any other checks that we deem are necessary at that time. And if somebody does not pass this criteria, unfortunately, they are not deemed suitable as part of our team. Well, all carers will need a minimum of 1 year's hands-on experience. They will also need a patient moving and handling certificate, which we can arrange for them to do. And then they will need different criteria depending on what job. For instance, if they're working with children, they will need a children's first aid certificate. And of course, we need all of our carers to be on the path towards a FETEC 5 major. Well, a lot of people are very unsure about this, so the best thing they can do is, if they want to pick up the phone and give me a ring, and I can talk them through with it. If I feel they need to go on, and as I said, once again, maybe to do the FETEC level 5, I can certainly point them in the right direction and advise them as to which course they should be taking. Absolutely. This is how most people will come into the caring industry, and this is invaluable experience. But once again, I would recommend that they do a FETEC level 5 in something relevant like practical home care skills or care of the older person. It just gives them that little bit more confidence in their role. Yes, we do indeed, and for a more specialised case, we're more than happy to supply nurses. Obviously, they will have gone through the same rigorous background checks as any of our carers, and then they would also have whatever other qualifications are necessary to meet our clients' needs. Obviously, compliance is very, very important in the caring industry. When a carer joins us, first of all, they will go through an intensive induction programme, which includes things like emergency procedures, code of conduct, elder abuse, infection control and care plans. It is then part of my job to make sure that all qualifications are kept up to date. For instance, patient and moving handling certificate needs to be done every 2 years. Visa requirements are checked, Garda vetting is updated, and then anything else that's necessary within their job role. And of course, all nurses carry ongoing registration with onboard alternates. Well, the easiest way to get in touch with us, if you go onto our website and you can fill out the online application form. But if somebody isn't comfortable with that, that's no problem. They can post in their application forms, they can drop them into us here in Lucan, or they can give me a ring at any time.